Dr. Roza, welcome to Warrior Voices with Sangita.
Hello, Sangita. How are you? Such a pleasure to be with you here. Thank you for inviting me.
Dr. Roza, you've had such a distinguished career in women's health. What are the most common cancers affecting women today, and why is early detection so critical?
So, Sangita, we're living in a world which is at odds with itself. And there are so many diseases. Now, if you say cancer, when you talk about in women, especially, which is my domain as a gynecologist, cancer is not preventable. It happens. But there are ways, that you can make it to be detected easily. And the reason why in women it's important, because right now, if you see, breast cancer is on the rise. Years back, it was cervical cancer. But now, if you see, there is 26% of the women in India, if you talk about India, are having breast cancer. And then you come next will be cervical cancer, which is a mouth of the uterus when we talk about. This was a leading cancer all over the world. Right now, it's the second most, with 17.7% of women being in India affected. In women, the third would be in order 6% with ovarian cancer.
Are there any early signs or subtle symptoms
Absolutely.
women often ignore and could indicate something
Absolutely.
serious?
And let's talk about breast cancer first. So, if in a woman you find usually there is something abnormal in your breast in form of a little lump, or there is little bit of change in size, we often stand in front of the mirror. We often try to wear our clothes, but why not during bathing or saying, touch yourself and see? I'll come to that later on. But change in size, the nipple, the discharge that comes from there sometimes, besides milk, could be watery or with blood stain. Sometimes a nipple gets retracted within inside. Later stages of breast cancer would be something like the skin would be a little more painful on that side. There is reddish discoloration. It's a little warm. And then the swelling of the underarm is also another sign, but that comes in later stage. So the beginning could be very subtle, but again, you will come to know there is something abnormal.
Pain, where did you say? Pain in the breast or in the skin? On the skin?
On the area where it's affected. So that area which is affected in this breast would be painful. Not necessarily the whole breast, because something, Sangita, we have in terms of premenstrual syndrome, where the both breasts get pain and engorge. So that's very different. That's very normal. That's very physiological. That is related with the progesterone and estrogen.
What kind of pain would that be? It would be a persistent pain, or would it be something that comes and goes?
So the pain would be usually my patients come to me saying that, my son or my little boy, touched me, or, somebody boxed me or something happened. So I started feeling pain. So the pain is not going to be always there until you press it a little bit. So that's what examining the breast from time to time is important. It's not going to, in the earliest stages, it's very subtle. So when you feel your breast, you will come to know there's some uneasiness, not in all the areas, but in certain quadrants. So this is with breast cancer. When you talk about cervical cancer, because that's again is one of the leading causes, 17% of women in India get affected. So the early signs will again be a little misleading in the sense the woman will experience white discharge. She will have in between menstrual cycle spotting. She will have bleeding after a sexual contact, sexual intercourse. So these are the beginning signs. And then she'll come to the doctor saying, I'm having a little foul smell, with my discharge, which is coming. So these are the very early signs in a woman with cervical cancer. So be very careful with white discharges. The ovarian is something which is quite difficult to diagnose. That's why I want through this video give a message to everyone that you must get yourself examined regularly, because you never come to know when the ovaries are having tumors. You never come to know about it. But in later on stages, you will have the patient will start having a little uneasiness in the lower abdomen. She will feel bloated, she will feel discomfort. And in later stages, if that goes, the ovarian cancer is a very good cancer to treat quickly. But in later stages, when it comes to your diaphragm, just below your chest, then difficulty in breathing, there is water in the stomach, as I must say, ascites in layman's terminology, and difficulty in passing urine, pain, defecation, and again, cachexia, that is loss of weight, loss of appetite. Later stages will not be too good.
How often
Yeah.
should women get screened for cervical and breast cancer? And what are the
Uh,
recommended tests?
So we have called something called breast self-examination. So a girl at the age of 20, I must say, you should start, knowing your breast. You should start examining yourself at least every month when you go for about a simple thing round your breast, you go and then you examine yourself. But once you age between 20 to 39, you must sometimes even visit your doctors. Maybe I would say a clinical breast examination. That means you go to a gynecologist. And that can be done if it's a normal case with no history of family cancer, everything is okay. Every 3 years, you should go to your doctor. Once you cross 40, I would say, you must go more often to your gynecologist so that the gynecologist can examine your breast every year. This is part and parcel of a woman after we say post, childbearing age. We finish our childbearing by 35, 36 years. So beyond 40, you need to be a little careful with your breast. Now, with the cervical cancer, there are certain tests. I'll make it very simplified. So when you go to a doctor, they can do a visual inspection of the cervix, and we do a test called VIA. So with that test, you come to know if there is any problem on the cervix, and those women, especially who got white discharge, who could do it. So if you're sexually active after the age of 30, maybe when you finish your childbearing period, you can go this test very easily. Between 30 to, I would say, 56 years, it's very important to go and get yourself examined. And a pap smear, which is really something that can, avoid future complications, which could be done every 3 years. But beyond the age of 40, I would say annually if you can, especially for those women who have got white discharge, who have got, regularly itching, foul smell. So more often for them, maybe, annually you can go. And then, of course, the detection. If you're 65 years, Sangita, many women come to me that, we've got our test negative. So do we have to do again after 65? So if your 3 tests are negative, after 65, you don't have to do that because menopause has set in and you're beyond that. Luckily, no cancer of the cervix. So coming to the ovarian cancer, which is again very important, and I always tell my patients who are 30 years and above, you must get a transvaginal sonography done after the age of 30, 35. So with the TVS, we call it, we get to know the size of the ovary. Most often patients who come to me with ovarian tumors, these are physiological, they're not malignant, they are non-malignant. Not all ovarian tumors are malignant. They could be just a growth, but however, you never know how it's going to change into malignancy. So transvaginal sonography or internal ultrasound is very important. I would again say that many women go and do an abdominal ultrasound. There's a difference between an internal scan as well as an abdominal. For women, I would tell all my women listeners, transvaginal sonography is something that they should do, which is more diagnostic, more, easily done. However, if there is a tumor and your age is 35, you're worried about it, there is a blood test called CA125, which could be done. However, it is not routinely done until and unless we see the ultrasound report, we evaluate the patient, see the history of the patient, and then advise them. So ovarian tumors, I would say, don't worry about it. But the only thing you should do is after the age of 30, 35, get a scan.